Abrasions and medico-legal importance. What are the learning outcomes? Definition, types and medico-legal importance. To define an abrasion, abrasion is a type of mechanical injury, and I am going to highlight certain words. A mechanical injury characterized by the destruction of the superficial layers of the skin, that is epidermis, typically resulting from blunt force trauma, friction or pressure. Because it is only involved with the epidermis, it bleeds less and heals without scarring. However, there may be deeper dermal injuries as well, and it results minor bleeding and also faint scarring as well. But it is not a fibrous scar that we are going to name it as a genuine scar. It is just merely an area of hyperpigmented area. So, technically speaking, there is no scar formation with abrasions. I am sure now you have got certain queries in your mind. How about a drawn injury on the skin with the tip of a safety pin? Now you know the tip of a safety pin is very sharp. What has happened now? As I have explained you earlier, it is the mechanism that matters. Alright, so now abrasions could occur due to blunt force trauma, friction or pressure. And also you might ask, can we have internal organ or mucosal abrasions as well? There may be certain queries among academics. However, visceral linings of the body can get superficial disruption with tissue continuity. What are the types of abrasions? There are 4 types, but there may be certain other types as well. Scratch or linear abrasions. As you can see here now, it does not have a width, but it has a length. It's a linear injury caused by a sharp object running across the skin, such as nail. When you think about the mechanism, the scratched epithelium is carried in front of the object causing the abrasion and heaped up at the end. It indicates the direction of the force applied. The second type is grazed abrasions. When a skin is contacted with a rough area, it scratches the skin, as you can understand, and also you can guess and you can nicely see here, right? So the skin scratches against the rough surface with multiple parallel lines. So by appreciating the grazed abrasion, you can tell about the starting point, ending point, etc. And in addition to that, now you can see here little skin tags. By appreciating, this is not a typical picture, however, I just wanted to show you what you mean by skin tags. By appreciating skin tags also, you can tell about the direction of the force and tell about the reconstruction of the event as well. The third type is imprint or pattern abrasions. Now, as words implies, it has got a pattern mark. As you can see here, you can see nicely a pattern there, and also it causes the mirror image of the mark that was pressed on the skin. So what's the mechanism? It is produced by a direct vertical pressure or a perpendicular pressure by direct impact of an object on the body surface, and it leaves its impression. So what's the medico-legal importance here? You can prove a contact definitely, and also with the shape you can link the offending vehicle in a suspected case of road traffic accident. What are the other examples that you get imprint or pattern abrasions? Ligature mark in case of strangulation or hanging. In hanging also you can get friction abrasions as well if the friction is the striking component. rather than having vertical pressure on the neck, and also it could be due to muscle mark in contact firearm injury, and also with manual strangulation you can get nail marks as well. The fourth type is friction abrasion. As you can understand, as name says, it is due to the friction of an object with against the object. The best example is ligature mark in hanging and strangulation. Now, a little while ago we discussed that with strangulation and hanging you can get imprint abrasions as well. Now, you can understand clearly the mechanism matters. If the pressure applies with the ligature perpendicularly to the skin, right, so there may be imprint abrasion, or if it gets a sliding movement along the neck, there may be the friction abrasion. The fifth type, there may be other types as well, but nowadays textbooks describe impact abrasions. That means a blunt object or surface strikes the skin with significant force, usually at or near a perpendicular angle, as you can see here. Here it's a bony prominence. If a pressure or a force applied straight away to the bony prominence, you get an impact abrasion. What do you see here in this image? Can you see abrasion like injuries over the skin? That means just scraping of the epidermis. What do you think? Are they antemortem or postmortem? Right. So now these are caused by ant bites after the death. You know, antemortem means before death. Postmortem means after death. Now these injuries are caused by ant bite on a dead body. Now you can understand these are very much similar to antemortem abrasions. How do you differentiate both? Now antemortem and postmortem abrasions, you can see reddish brown to black in color, but usually the postmortem ones are yellowish and translucent, as you can hear. You can read this one leisurely. The basic idea is you can't see any bleeding, inflammation or anything. Right. So, however, in case of antemortem injuries, you can see what's the basic name that you have to know, the term. You can see vital reaction that is comprised with edema, bleeding, swelling, reaction, inflammation and all. Right. So, this is just very pale in color, but just removing of the skin by ants. Healing of an uncomplicated abrasion. Now again, very important aspect that we are going to describe. Right, have a look of this boy's face. You can see here this area is scabbed, but here scab had been peeled off. Here also you can see scab. Here again basically remove the scab. Here actually very much healed abrasion, you only can see an area of or areas of hypopigmented areas. Now you have to know that abrasions are very good to time injuries when compared to other types of injuries such as contusions or lacerations. Abrasions is the best indicator to time injuries, since these are very much superficial injuries and there will not be any complications such as infections. Bright red when it is fresh. You can see a red scab within 1 day and then reddish brown scab 2 to 3 days, and healing starts around 4 to 7 days and then healing complete usually 7 to 10 days. Finally, let's discuss about medico-legal importance of abrasions. Definitely, abrasions indicate the site of impact. That means you can tell about the site of impact, and sometimes superficially there is only a minor injury, but there may be serious underlying injuries. So you have to exclude about underlying injuries whenever you see a superficial abrasion, even though it is minor. And also you can predict or you can reconstruct about the weapon used. because of the pattern nature in certain situations. And also you can predict about circumstances of the injury. Example, if you can see nail marks on the neck, that means nail marks means imprint abrasions. If you can see certain imprint abrasions over the neck, so you can think about a case of manual strangulation. And also if you can see certain nail or grab marks or imprint marks over the wrist joints or over the thighs, then you can think about a possibility of sexual assault. And also you can appreciate about the direction of the injury and timing of the injury, and it is one of the most reliable out of many other crude methods that we use basically by appreciating the nature of the injury, such as contusions, abrasions. And what do you think about the categorization of hurt? Since these are the injuries happen to the superficial layers, so the categorization of hurt is non-grievous. And also it helps to reconstruct the events as we have described, and also it tells about the direction of the application of force, and also it tells about the type of force as a blunt force application. Regarding abrasions in medical legal practice, true or false? Abrasions do not leave a scar. Yes, it's true. Abrasions are the most reliable for dating when compared to other types of injuries. Definitely true, because these are superficial injuries, no complications. An abrasion is completely healed within 2 days. No, it's incorrect. It usually takes 7 to 10 days. Abrasions are helpful in reconstructing incidents. Definitely correct. They are helpful in determining the type of crime. Yes, you can think about the type of crime. If you can see imprint nail marks on the neck, you can think about the possibility of manual strangulation. Abrasions are not seen away from the site of injury. Yes, it's again true. Now, whereas to that, you can see contusions away from the site of impact. But abrasions have to have ideally a direct impact to cause the superficial scraping of the skin. And bites resemble abrasions. Yes, true, because ants are going to scrape the superficial layers of the skin, mimicking antemortem abrasions. Postmortem abrasions are unlikely to occur. No, it's incorrect. We can have postmortem abrasions definitely. Abrasions on the face are grievous. No, it is incorrect. No scar formation, nothing. Handcuff injuries cause friction abrasions. Yes, earlier I have described about friction of an object along the skin. It causes friction abrasion. Now you can understand handcuffs also could cause friction around the wrists, causing friction abrasion. So this is true. Imprint abrasions require perpendicular force. That's true. That's why you get the same identical features as per the object. Imprint abrasions are useful in tracing a vehicle in hit and run accident. Yes, imprint abrasion leaves the shape of the object impacted on the skin, and we can link both the injury and the suspected vehicle based on the Locard's principle. So it is true. Thank you very much.